Even if everything goes right, every paycheck is budgeted, every 401k contribution made on time, every bit of financial advice followed to the letter, retirement still looks like a cliff for most people. Why? Because the very systems designed to support aging Americans are crumbling. Social Security is heading for deep cuts. 401s, KS, aren't just underfunded. They were never built to carry this much weight. Healthcare costs alone can wipe out a lifetime of savings. And pensions? They're already gone for most. The dream of a comfortable retirement isn't fading. It's exploding. And it's millennials who are going to feel it the most. Section 1, Social Security Cuts. The year 2033 isn't some distant future. It's around the corner. That's the year the Social Security Retirement Fund, the Old Age and Survivors Insurance Trust Fund, is projected to become insolvent. What does that mean? It doesn't mean the program disappears, but it does mean benefits will automatically get slashed by about 24%. That's not a hypothetical. That's how the system is currently built. When the trust fund runs dry, benefits get paid out only from incoming payroll taxes, and those taxes won't cover full benefits. Right now, the average retiree gets about $1,976 per month. But once the cut hits, that number drops to around $1,560. That's over $400 gone every single month. And this isn't temporary. That $1,560 becomes the new normal, possibly for decades. Multiply that over a year, and you're looking at a loss of $5,000. The federal poverty line for a single adult is roughly $15,000. This cut would push millions of retirees dangerously close to or below that line. Millennials retiring after 2050, they're facing even steeper reductions. Some projections estimate benefit cuts of 40% or more for that generation. It's not alarmist, it's arithmetic. And the fix isn't coming anytime soon. Lawmakers have had decades to patch the hole, but political gridlock has left the system limping forward. Instead of raising taxes or tweaking benefits gradually, they've kicked the can. And now that can is rolling toward the edge of a cliff. What makes it worse? The trust fund has been operating in deficit mode for years. Since 2010, outlays have exceeded payroll tax revenues. In 2024, the system spent about $1.48 trillion, but only brought in $1.42 trillion. The gap is growing. Reserves, essentially savings from prior years, are being drained. Once they're gone, it's lights out for full benefits. Even recent legislative changes like repealing the windfall elimination provision and government pension offset gave some retirees short-term relief, but did nothing to address the structural funding crisis. And with the birth rate falling, immigration slowing, and income inequality widening, the base of workers paying into the system just isn't enough to support the growing retiree population. Fixes exist. Lawmakers know them. They could raise the payroll tax cap, gradually increase the full retirement age, adjust cost of living formulas, but they haven't. And every year of delay makes the eventual fix harder and more painful. So the writing's on the wall. Social Security is shrinking, and future retirees will have to do more with less. Section 2, 401k S are insufficient. This was supposed to be the replacement for pensions. The 401k, self-directed, tax-advantaged, flexible, a retirement revolution. But here's the hard truth. Most 401ks are failing to deliver even basic retirement security. Right now, the average 401k balance for Americans aged 55 to 60 is about $45,000. That's not a typo. 45 grand. Not enough to buy a new SUV, let alone fund 30 years of retirement. Following the traditional 4% rule, where only 4% of your portfolio is withdrawn annually to ensure it lasts, $45,000 gives you just $1,800 per year. That's $150 per month. Stack that with the future Social Security payout, $1,560 after the 2033 cuts, and the total retirement income becomes $1,710 a month. That's barely above the poverty line. Rent, food, prescriptions, utilities. This doesn't cover it, not even close. And that's assuming the account isn't rated early. but more and more people are tapping into their 401s before retirement. In 2024, hardship withdrawals hit 4.8%, up from just 2.8% 2 years earlier. People are using retirement savings to survive today's financial emergencies, which makes tomorrow even more uncertain. Even worse, many Americans don't have a 401k at all. Part-time workers, gig workers, small business employees, millions don't get access. And for those who do, it's often a bare-bones plan with low employer matching, high fees, or long waiting periods before enrollment. Nearly 1 in 4 retirees today has no retirement savings. Zero. Not because they were irresponsible, but because wages stagnated, costs surged, and the do-it-yourself retirement model was never designed for this level of economic pressure. For decades, workers were told to invest in hope. But hope isn't a strategy. And when 401s become the main pillar of retirement, and most people can't even fill that bucket, the whole structure wobbles. Research from financial health experts shows that eliminating waiting periods, allowing workers to contribute to 401s from day one, could significantly boost savings. But only a fraction of employers have adopted that change. And for workers living paycheck to paycheck, the idea of contributing even 3% of gross income feels impossible. The reality? 401s were meant to supplement pensions, not replace them. But pensions have vanished. And what's left is a fragile system that assumes too much from individual savers and lets employers off the hook. The result? Most Americans enter retirement with too little, too late. Section 3. Healthcare bankruptcy. Even if the math barely works with Social Security and 401s, Ks, the real gut punch in retirement is healthcare. Medical costs are the hidden avalanche that can bury decades of careful planning. And it's not just a risk, it's already happening to millions. Medicare, which is supposed to be the safety net for retirees, is itself heading for a funding cliff. By 2033, just like Social Security, the program faces insolvency unless reforms are made. That means higher premiums, reduced coverage, and more out-of-pocket costs. Already, Medicare Part B premiums are around $200 per month, but projections suggest they could double to $400 by the mid-2000s. Deductibles? Currently sitting around $1,500, but by 2035, they're expected to exceed $4,000. That's per person, per year. And then there's long-term care, the need nobody wants to talk about. 7 out of 10 people turning 65 today will need some form of long-term care, but it's not covered by Medicare. And the average cost for a private nursing home? Over $100,000 per year. 2 years in long-term care, and even a well-funded retirement portfolio gets vaporized. Medical debt is the #1 cause of bankruptcy in the United States. In fact, about 62% of retiree bankruptcies are driven by medical expenses. And this isn't just about being uninsured. Over 90% of Americans have some form of health insurance, but a growing number are underinsured, trapped in plans with sky-high deductibles, limited coverage, and confusing networks. As of 2024, about 23% of working-age insured adults are underinsured. That means millions walk into hospitals thinking they're protected, only to be slammed with surprise bills, denied claims, or massive copays. And when insurance doesn't pay, the debt begins. Today, 107 million adults in the U.S. carry some form of medical debt. Nearly half owe more than $2,500. 1 in 8 owe more than $10,000. These aren't people ignoring bills. These are people choosing between prescriptions and rent. And medical debt doesn't just drain savings, it crushes credit. Even with new protections limiting how medical debt affects credit scores, the damage is done. Lower credit limits access to housing, loans, and even jobs. Black and Hispanic retirees suffer disproportionately. Due to decades of structural inequality, they're more likely to live in states with poor Medicaid coverage, more likely to have limited savings, and more likely to face medical debt that leads to financial ruin. So when the system breaks down, it doesn't break evenly. It breaks hardest for those already standing on shaky ground. Section 4. The math of retirement. The raw numbers of retirement don't lie. The minimum needed just to survive, not thrive, just survive in retirement, is over $2,000 a month in most areas. That covers modest housing, groceries, transportation, utilities, and basic healthcare. Nothing extravagant, no cruises, no beachfront condos, just life. But here's what millions are facing. After Social Security cuts, the average monthly income drops to around $1,560. Add in the average return from a 401k with a $45,000 balance, which brings in about $150 a month, and the total income comes out to $1,710. That leaves a monthly shortfall of at least $300. And that's just for the basics. Factor in rising healthcare costs and things get worse. Medicare premiums alone are projected to hit $400 monthly. Deduct that from the already tight income, and now retirees are operating with closer to $1,300 a month. That's the real gap. And it doesn't include out-of-pocket drug costs, dental work, eyeglasses, or emergency medical bills. And let's not forget inflation. Healthcare costs are rising faster than the general inflation rate. While most goods and services rise about 2 to 3% a year, healthcare inflation is consistently above 5%. That means every year retirees are spending more to get the same care or less of it. But the real danger isn't just running short, it's outliving money. People are living longer. Someone who hits 65 today has a good chance of living into their 90s. That means a retirement that spans 30 years or more. And most portfolios, especially if small to begin with, simply aren't built to last that long. The traditional model of retiring at 65 is outdated, and yet the system hasn't adjusted. The average working adult is still expected to retire around 65, but with dwindling savings and shrinking Social Security, retirement at that age is a pipe dream for most. More people are working into their 70s, not because they want to, but because they have to. The gap between cost of living and income doesn't close with age. It widens. Widowed spouses often lose a significant portion of household income. A sudden illness can wipe out emergency funds. And long-term care, which most retirees will need, isn't optional. It's expensive, and it's coming. A recent analysis found that 45% of older households already can't afford their basic needs. And here's the gut-wrenching part. 80%, yes, 80% of older households are either struggling today or at serious risk of falling into insecurity as they age. That's 47 million households staring down a financial cliff. This isn't just about money, it's about health too. Lower income older adults die 9 years earlier than their wealthier peers. That's the cost of financial insecurity. It's not just a matter of discomfort, it's a matter of life and death. Section 5. What millennials can actually do. The crisis is real, but it doesn't mean giving up. It means preparing differently. Retirement isn't disappearing, it's just changing. The first step is accepting that the old model is broken. Waiting for Social Security to carry the weight? That plan is out. Hoping a 401k will stretch for 30 years? Unlikely. Depending on Medicare to cover everything? That's a gamble. So what does preparation look like now? It starts with mindset. Working until 70 is the new normal. Not 65, not 62. Delaying retirement, even by a few years, boosts Social Security payments and gives savings more time to grow. Every extra year worked is more money saved, and fewer years the money has to stretch. But it's not just about working longer, it's about working smarter. Developing skills that can be monetized during retirement matters. Teaching, consulting, freelancing, coaching. These are flexible paths that provide income later in life without the grind of full-time employment. Home ownership plays a big role too. A paid-off home is more than a place to live. It's a hedge against inflation. Owning a home outright reduces expenses and provides equity that can be tapped later if needed. It's a form of security that renters simply don't have. Roth conversions are another tool to consider, especially now, while tax rates are relatively low. Paying taxes up front means withdrawals in retirement won't get hammered by higher rates later. It's a strategy worth looking into before brackets shift. Dividend income can also make a difference. A $200,000 dividend-paying portfolio yielding 2.5% generates around $5,000 a year. It's not enough to live on, but combined with other sources, it fills critical gaps. The most important shift? Stop depending on the government to fix it. Congress hasn't acted in decades to fix Social Security. Medicare funding is on the same sinking ship. Political gridlock isn't going anywhere. Waiting for a policy rescue isn't just wishful, it's dangerous. Preparation now means choosing action over assumption, learning over hoping, and adapting to a retirement that looks nothing like the one past generations had. This isn't fear-mongering, it's the math. Retirement, as it's currently structured, doesn't work. Not for most. Even those who've saved diligently are facing cuts to Social Security, rising healthcare costs, and savings that can't stretch far enough. The safety nets are fraying, the gaps are widening, and the timeline is shrinking. A nightmare retirement isn't reserved for those who didn't plan. It's waiting for anyone who planned using the old rules. So the choice is clear. Prepare for reality now or face the consequences later. Retirement doesn't start at 65 anymore. It starts with action today. Don't leave your future up to chance. If this breakdown helped clarify what's really happening behind the scenes, make sure to hit that subscribe button and share this video with someone who still thinks retirement is guaranteed. New videos every week digging into the financial realities that no one else wants to talk about. It's time to stop hoping and start planning. See you in the next one.